So, when a patient's having a stroke, time is very, very important. Every second, every minute that goes by, there are brain cells that are dying and can potentially lead to worsening outcomes. And so, whatever treatment that the patient may get, whether it's just a blood thinner or if they're going to get the surgery, which is we call it mechanical thrombectomy, the faster they can get to medical attention and the faster they can get treated, the higher chance there is that they're going to have a functional recovery. And so it's extremely important to get to medical attention as soon as possible.
What are some of the things that can happen if they don't?
Well, every single patient can tolerate the blocked vessel for different amounts of time. And certain patients can tolerate it for only 30 minutes to an hour, and certain patients can tolerate it for many hours, meaning that once the vessel is reopened, they may or may not have the permanent stroke. And so if they can get to medical attention quickly, and we can get the vessel open either with the blood thinner or with the surgery, there's a possibility of regaining the function that is suddenly lost at that moment. But if too much time goes by and the permanent stroke establishes itself, then the patient may be left with a permanent deficit, and that could be movement or sensation or speech or vision. It really depends on where the stroke hits.
Some people might be concerned that the hospital, if it has COVID patients, it's not safe, but it is safe. Could you talk about some of those ways that people don't have to worry that it is safe?
Yeah, well, people definitely should not worry and should not neglect any concerning symptoms because of the coronavirus for a few reasons. One, we actually have a very low rate here in San Antonio compared to other places in the country, likely because we did very good social distancing early on and didn't really get that surge of cases. Number two, we have protocols in the hospital in place for the coronavirus patients and for any patients that are under suspicion. And even if the patient themselves that's having a stroke is coronavirus positive or is a patient under suspicion, we have protocols to continue treating those patients in all the personal protective equipment that's necessary to reduce the spread of the virus, and we are able to treat those patients even if they are COVID positive.